And now to our Medical Monday. And with the end of the year approaching, some families might also be dealing with the tough topic of end-of-life care. Now, the hospice coordinator with Emplify Health by Gundersen says while a terminal diagnosis can bring with it a lot of fear and unknowns, the hospice team can help ease the burden for people and families through experience. Molly Alexson encourages people considering hospice to reach out sooner rather than later, as it is covered by Medicare and a number of insurance plans. They can get someone in the system within 48 hours, and it often makes medical care easier moving forward.
We have 4 staffed providers that make visits daily. So instead of you going into the clinic to see a provider when you've got a symptom that needs to be managed, it's kind of like in the olden days where they come to you and they, put on their boots in a snowstorm and head out to see people. So we can get things rather quickly, where, as people know, it can be hard to get an appointment, or you're sitting in urgent care or the ER for, hours sometimes. So this is a easy way for people to access care towards the end of their life.
That care extends beyond simply medical treatment. Alexson says the hospice team can also help with quality of life experiences, whether that's a massage, music therapy, a visit to Rotary Lights, or even, she says, a trip to Vegas. It's all about coordination and communication, which continues with the family even after end-of-life care.
We have a bereavement program that supports people and their families at the end of life and the grief process. And so we check in with people to see how they're doing. So that is an added benefit up to a year after someone passes.
Alexson says the hospice team includes social workers, chaplains, and volunteers in addition to healthcare workers, but it wouldn't be possible without the volunteers, who she credits with creating the hospice program.